we need to start listening to what these men have to say. We need to reach out, sit down and listen to what their experiences are like. I see it as an opportunity for me to not just come here and rely on experts to help me do the work that I want to do, but to also share and educate the people here about the different groups of men that exist in other parts of the world. And I think that's really important for academia, especially within men's health research, when we talk about masculinities, when we talk about men's health, and we want to talk about equity within those domains. We need to think and include different groups of men, not just within Canada, but from different parts of the world. So what happens in Malaysia is that when it comes to sexual health services, HIV testing, HIV treatment, a lot of the time, a lot of these men do want to access these services, but because of various forms of stigma, for example, stigma associated with the LGBTQ+ community, and that is further compounded by HIV-related stigma that results from a lack of education, lack of HIV/AIDS awareness. All of that sort of leads to a lot of these men not being able or not feeling confident or safe enough to access mental health services and other forms of services, including HIV testing and HIV treatment. And this has severe implications on their mental health because a lot of them have this sense of anxiety, have this sense of fear about they're worried about their mental health, they're worried about their health, they're worried about acquiring HIV, they're worried about acquiring other forms of STIs. But because of discrimination that's quite prevalent even within the healthcare setting in Malaysia, they're unable to access a lot of these services. The other thing as well is the lack of LGBTQ+ sensitive training among healthcare practitioners like doctors, nurses, mental health practitioners. They don't have that training, so it becomes a challenge for this group of men to access a service that is equitable and non-judgmental. So for a lot of these men, they're constantly trying to decide, do I just not go and get the services, or do I just stay at home, or do I risk going and engaging in the services and potentially facing a lot of this criticism and judgment? There is a difference between sexual minority men and gender minority men, and so that those differences are informed by their own lived experiences. So in the way in which they would build their relationships would be very different. When it comes to incorporating equity into your relationship, it's not just about one person being a fair and loving partner to another. A lot of other things sort of influence that. So I guess in that sense, just thinking about access to mental health services, access to good job opportunities, access to the ability to just be able to get married, which is something a lot of sexual and gender minority people want. A lot of those things would actually be able to help a couple build an equitable, intimate partner relationship. In research, in academia, or just in general, we tend to ask a lot of questions, but we don't always listen to the answers that we get. We need to start listening to what these men have to say. We need to reach out, sit down and listen to what their experiences are like, about what works for them, about what kind of challenges that they're facing. I think that's a strength-based approach that we need to really adopt in the work that we do if we want to help these different marginalized communities, because they do have a voice, but oftentimes their voices are not heard, or their voices are overshadowed by a bunch of different things. To be able to engage with a lot of these people who have had years of experience doing research in this area, who have been working with men, I've been able to learn a lot from them. The fact that everyone was just very humble, was very friendly, and I think that was really helpful for me as an early career researcher to be able to just connect people on that level. I came in here thinking that I got it all and I'm ready to start this, but then I realized there's just still so much for me to learn. There's just still so much for me to read about, and there's so many different people that I still need to talk to, and that's not a bad thing. I think that's a good indicator of growth for anybody who's interested or wants to pursue graduate studies. Go in with an open mind, wanting to learn more, and I feel there's the whole idea of gaining knowledge is an endless process, And I'm starting to see that here, and I enjoy it, and I'm just really excited to just keep doing this in the next few years that I'm doing.